So I want to now, it is my distinct pleasure and privilege to introduce Premier Kathleen Wynne, who is Ontario's 25th Premier and the first female Premier of this province. She was elected to the Ontario Legislature in 2003 as the MPP for Don Valley West, and she became the leader of the Ontario Liberal Party in January 2013. She was re-elected on June 12, 2014, with a majority government and was sworn into office on June 24, 2014. Kathleen has served as Ontario's Minister of Agriculture and Food, Minister of Municipal Affairs and Housing, Minister of Aboriginal Affairs, Minister of Transportation, wow, and Minister of Education. Premier, we are so delighted to have you with us here today, and that you have given us your time and will be allowing for a brief question period following your remarks. And I promise that the question period, I can really reassure you, it will be far more orderly than Queen's Park. So please join me in welcoming to the podium Premier Kathleen Wynne. Welcome. Oh, you got your water?
I got my water, yeah.
Very good. Thank you.
I've got my water because I've got a cough, and question period at Queen's Park is a very low bar, folks, so this will be way better. So good morning, thank you all of you. Carol, thank you very much, and thank you for welcoming me. It's a great pleasure to be here with you. J'espère que votre congrès a commencé de belle façon. Merci de m'avoir invité parmi vous. I want to take a moment to acknowledge, as I always do, that long before we began meeting here, discussing how we're strengthening our healthcare system together, this land has been a gathering place for many Indigenous peoples, and I want to show my respect for First Nations and Métis people. And how for countless generations they have shaped Ontario and continue to do so. And I think that particularly in this year of our 150th celebration, we recognize that it is a wonderful thing that Ontario and Canada are 150 years old, but it's an even more wonderful thing that long before that 150 years, there were people here who were stewarding the land and who welcomed the first contact from other parts of the world and helped people who came from Europe at that time to acclimatize to this environment. So pay my respect, and particularly to the Mississaugas of the New Credit. So I have to, yes. As I do, my daughter Maggie has been in nursing, in the nursing program the whole time I've been Premier, and she's graduating. She's graduating this spring. I can't wait for her commencement, and I know she has a challenging and rewarding career ahead of her. I also know that Doris is going to do her very best to make sure that she embarks on that challenging and rewarding career, and that she's doing it as part of RNAO. I know that she's... So your theme this year for your AGM is values, evidence, and courage. And that strikes a particular chord with me. Values, evidence, and courage are exactly the things that we as a government have to draw on when we're making decisions and when we're designing programs for the people of Ontario. Yesterday, our Minister of Finance delivered Ontario's 2017 budget, and it's the first balanced budget since before the recession. And at the center of that budget is healthcare. For me, the point of having a balanced budget, the point of having worked so hard since the economic downturn to get our fiscal house in order, is that we can now have the flexibility to invest in what the people of Ontario need. And that is the point of this budget. And it starts with a $7 billion booster shot that will increase access to care, reduce wait times, and enhance the patient experience. But that really is just the beginning, and it is what the healthcare sector said to us was needed at a minimum. There's a Joe Biden quote that goes, "Don't tell me what you value, show me your budget, and I'll tell you what you value. Well, so I'm proud to be sharing this budget. It shows fairness is at the heart of all that we do and all that we aspire to achieve in Ontario. And it shows that we'll get there by investing in people and in communities. So today, I want to talk to you about our government's plan. I'm excited about it, and I'm excited about the vital role that healthcare plays at a time like this. So I'll be frank. Here in 2017, we're entering a very new and different era. Whether it's technology or whether it's Trump south of the border, it is a time of greater uncertainty and change. There's no doubt about that. People are anxious about the future. They aren't sure if their jobs will be around in 10 years or 5 years or even less, and they worry about what opportunities will be there for their children. So in uncertain times like these, I believe that government has a responsibility to respond. That's what government exists to do, is to help the collective when there's that kind of uncertainty and where there are challenges. A responsibility to step up, to play an active role. And we're in a good position to do this in Ontario. Our budget is back in balance. We've spent years building new roads and schools and hospitals and transit. More people are at work in Ontario than ever before, so we're prepared for this moment. We have the freedom and we have the flexibility to respond to these new challenges. So the key now is to make the right choices in order to support the people of Ontario as we all navigate through this turbulence and as we work to set our province on a course toward that long-term success that we know we're all capable of. Now, if the initiatives that I talk about today are going to sound familiar, it makes a lot of sense because the RNAO has advocated for many of them. You brought them to our attention, and for that I want to say thank you. And as I always do when I speak with you, I want to thank you for that ongoing partnership. I believe that government policy is only at its best when we are working with the people who are on the front line and who understand exactly what the challenges are. So there's never been a more important time for government to listen and then to learn and to act. And there's no better place to start than investing in the health and well-being of our children and our young people, the future of this province. I don't have to tell anyone in this room that Ontario's healthcare system is the best illustration of our shared values: fairness, equality, compassion. But I also know that there's a gap in coverage. You see it in your jobs every single day. Our Minister of Health, Dr. Eric Hoskins, has talked about it, and I think he talked about it here with you last night. How as a practicing physician, he found himself reaching into his samples drawer because his patients needed vital medication. But he knew, sitting across the desk from that patient or in the exam room, he knew that that patient wasn't going to be able to fill the prescription that he was going to write. They didn't have drug coverage through work. Their monthly budgets were already stretched. And the reality is that this is a growing problem in our new economy. More people are working on contract or they're juggling part-time jobs. Employment is less stable and workers can't count on a benefits plan as they used to. All of this has consequences for people and for their families. It means financial strain and it means emotional stress. And it means many children and young people don't have access to a drug plan through their parents the way they did in the past. This lack of coverage leaves mums and dads in particular in a terrible position, especially if their child has a chronic health condition like epilepsy or diabetes or asthma, or a mental illness that requires medication. I was just at an announcement of our new plan this morning, and I was talking with a woman who has 5 children, and she lives in Thorncliffe Park in the constituency actually that I represent, and she said that it was a huge strain. Her kids range from high school right down to preschool, and she said that last winter was very bad. The kids had a lot of illness, and it's a real strain with 5 kids, as you can imagine. She's at home with her kids, and her husband is an auto mechanic. So it's that mom who is under the kind of stress that I'm talking about. So the government has to step in. and we have to ensure that our healthcare system evolves with the times. And so we are moving. Yesterday we announced Ontario will be the first province to make prescription medications free for children and youth who are 24 and younger. Thank you. It's a great thing. It's a great thing. Thank you. And as I said, you have advocated for pharmacare, and I know that. You'll hear us calling it OHIP Plus, and it starts on January 1st, 2018. So it starts as quickly as we can possibly get it in place. Coverage is automatic. It's not application-based, so you don't have to sign up, and there are no upfront costs. You don't have to pay. For the more than 4 million young people in Ontario that this will affect, it will mean a healthier tomorrow. Take a child who has asthma, as 1 in 5 children in Ontario do, or a student at college or university who's diagnosed with depression, something that we know is a growing concern on campuses across our province. I hear it when I travel to colleges and universities all the time. Our pharmacare program will be there for them. The medication that they need will be free. When we went into our budget planning process, we knew that we wanted to address the concerns of those who worry about falling behind in the changing economy. And we knew that we wanted to do it now, and we knew that because our budget was going to be in balance, we would have that flexibility in order to do it. Now, people are asking me the difference between what the NDP is proposed and what we are doing. And I think it's important that I address that, because I'm actually really happy that Andrea Horwath believes in the concept and is a proponent. I think that's a very good thing. The more of us who are saying that this is important, the more voices that we'll be able to take across the country, because ultimately, we need a national pharmacare plan. But I want to just explain the differences so you'll understand what it is we're doing. One of the important ways that OHIP Plus differs from the recent proposal of the NDP is that our program starts in 2018 rather than in 2020. The NDP was aiming for that later start date. Because of the design of the plan that we're putting in place, we're able to start in January 2018. It also differs in scope. Beyond the most common prescriptions, OHIP Plus will give young people access to more than 4,400 drugs, including drugs used to treat cancer and rare diseases. It made sense to us to have all of those in the program. The other proposal would give broad access to a much smaller number of drugs. So it's a different approach, but it is based in the same belief that there needs to be access. And in some cases, there would have needed to be a co-payment. Our program provides comprehensive coverage to all children and youth, and it doesn't matter how much you make or how much your parents make. So there's no means test involved in our program. Coverage is free. OHIP Plus represents the biggest expansion of universal Medicare in Ontario over the course of a generation. And it's a major leap towards, yes. It's a major leap towards universal drug coverage for people in this province. And I will tell you that I will be having an interesting conversation with my colleagues at the table of premiers when we meet in the summer, because I know there will be a lot of questions about this. When we brought in our free tuition plan, and I went to my first national premiers meeting, there were lots of questions about that. I anticipate there will be even more about this. We know that healthcare is changing, it's evolving across Ontario, and over the past number of years, we know that hospitals have done a lot of good transformative work. But they have been dealing with constraints. We acknowledge that. And frankly, we ask them to do more with less as we work to shift care out of the hospital and into the community. And that shift is still underway, as all of you know. But we've heard loudly and clearly that we still need to make sure that there is enough funding in the system for hospitals to continue investing in their frontline services. So we're increasing hospital funding by over $500 million in this budget. And that's an overall increase of 3%. And it means that every single hospital in Ontario will see their budget grow. So this is across the board increase. We've also greenlit 5 new major hospital projects from Windsor and Hamilton to Moosonee. And all of that means a better hospital environment for both patients and staff. We are working very hard to put patients first in Ontario, and you are right there with us, to give people better access to the right care when and where they need it. From new investments in home nursing and personal support to physiotherapy and respite services, including $5 million in yesterday's budget for the offloading devices for which you have advocated so strongly. Thank you. Thank you so much. Thank you so much for pushing for that and for making it clear why it was necessary. We're committed to seeing patients first, not just transition, but transform healthcare. And that includes care coordination in primary care and hospitals where appropriate. When we support each other, when we work together in partnership, we can create that positive change that we know is possible. Your role in primary care is a great example. As care shifts to the community, the role of nurses must expand. You told us that, and we heard you. So our budget does 2 things here. It gives nurse practitioners the authority to prescribe controlled substances. It also includes legislation that expands the role of RNs to prescribe drugs directly to patients independently of doctors. And we're very pleased to be funding RNAO to deliver the course on independent RN prescribing for RNs who are already in the system, because they need that training too. So thank you to you. Thank you to you for that. This change will make a real difference to patients who have established a rapport with their RN. And that's especially true in rural or remote parts of Ontario where physicians are not always available. And we'll continue to listen. We are hearing you loudly on the issue of RN replacement, and we'll continue to work with you. It's something that I'm concerned about, and I want to make sure that we intentionally move in the right direction on that. And that is not fewer RNs. That means more RNs, and keeping that line. Thank you. All of that comes back to the values, evidence, and courage that we talked about. That's why we're funding supervised injection services, and we're hearing RNAO and healthcare and corrections. So we've got a lot to do, and our shared belief in fairness and equality of opportunity is what is driving this. In this period of change, I believe that it's the responsibility of government to take a stand, to play a role and do what it can, and do all that it can to ensure that the people of Ontario are given every chance to thrive and achieve their potential. Honestly, I wouldn't be in politics if I didn't believe that. I wouldn't have run for government if I didn't believe that that was the role that government was to play. It's why we're introducing that free tuition that I just talked about for hundreds of thousands of students this fall. It's why we're doubling the number of licensed childcare spaces for children 0 to 4 years old. And it's why we're funding a basic income pilot project in Hamilton, Thunder Bay, and Lindsay. These are the kinds of ideas that we need right now. We need bold, unafraid policy development, ideas that will make a meaningful difference in people's lives and in our shared success. And we have to be brave enough to try some things. On the basic income pilot, you know, there was some trepidation. People were saying, well, you know, can this be generalized across the province? It's very expensive, and are you sure we shouldn't just raise the rates? Well, we need to raise the rates too, and there is an increase, and we are looking to how we can change change the current social assistance program that's in place. But the basic income has been talked about for 35 years. There was research that was done in Manitoba that showed results around job retention and kids staying in school and better health outcomes. Why wouldn't we go back to that and take up where it left off and figure out if there's a better way? That's the kind of courage that we have to have, particularly because we're in such uncertain times. So these are the ideas that will actively confront and diminish the uncertainty of this new era. And there is no more important time than right now for us to step up. Government has to have a plan. To be premier of this province, you have to have a plan. I do, and my team does. You're going to continue to hear about our plan over the months to come and why we believe in doing things that matter, not just right now, but for the future. The things that we know will have the greatest impact, the things that are building this province up. In an uncertain world, what we do know is our way forward. Dès que je suis devenue Première ministre, j'ai exprimé ma conviction que nous pouvons faire en sorte que le gouvernement soit une force de bien. Et en nous dotant d'un plan clair, ciblé et responsable, nous pouvons faire une différence positive dans la vie des gens. I told you earlier, merci, merci. I told you earlier that starting this summer, my family will officially include a nurse. But for years now, I've had the privilege of working next to Ontario nurses. That's because my constituency office is actually located on the main floor of Suomi-Koti. It's a seniors residence and a nursing home for Finnish Canadians. And one of my favorite recent memories was I popped in to celebrate the birthdays of 3 women who were turning 100. Yay, longevity. Too bad for those pension plans, because I remember when I was Minister of Education sitting down with the pension folks and they were just saying, oh, the women are all living so long. Yeah, there you go. So I popped into, sorry, it's great health care, exactly. Well, we were dancing. The 3 women and their friends on the floor were dancing, and I think that that's the kind of life that we all want to picture for people in this province. That at 100, you'd still feel so good about life that you'd want to dance, and that you'd have the care of compassionate healthcare providers who would give you the space to dance and give you enough of a loving environment that you felt joyful enough to dance. So that's what it's about. You're the people who are making that possible, and I'm grateful for everything that you do to make Ontario the healthiest, most caring place to live in North America, if not the world. Thank you so much. Merci. Miigwech. We'll take some questions.
1 minute. The Premier wants quickly to move to questions, but I have a duty, Premier.
Okay.
The pin is put in 2 places. One very good and the other ask. You know, always there is asks in this life. So the very good is on the first in Canada. There are a couple of firsts in Canada. The OHI Plus is first in Canada. And together we are going to push the Prime Minister. The second first, and I don't know if your team is aware, but actually the offloading devices is first in Canada. Take pride of that.
Thanks to you.
Yeah, thanks to my team here, the members.
You had to explain to me what they were.
I know,
Yes.
the first time we met, because I needed to help to share the atrocity of paying for $74,000 for amputations and not for $100 to $1,500. But you need to know that almost across the world, very few countries in Europe, in Northern Europe, is actually they cover. It's a disgrace. So first in Canada, hopefully we'll push the world also. And it will save taxpayers' dollars, lots, because the numbers are there. And I don't know if Miriam Boutros is here, my partner in crime, for the, is she? If she is, she needs to wave. Okay. Second in Canada, SIS, Safe Injection Services. Inside was first. Inside was first. You need to give her a hug. Why not?
Thank you, my public health.
So important. Thank you.
And of course, Shirley Kennedy, that is the mover and shaker on helping us move people in corrections from the correction system to healthcare. She is beaming. So you say dancing, we feel like dancing now, and we are not 90. Now, we are not 100 either. But now, on behalf of RNAO, and on behalf of my colleagues, if I may take you with me, Linda, we absolutely have a request that is urgent, and it's the issue of stop replacing RNs because it's happening. And a good place to start, which is in our report, a good place to start, the minister spoke yesterday, is interprofessional care. We are moving there, which is beautiful. The best place to start the stop the RN replacement, which is a must, is of course tertiary, quaternary hospitals in this province, which some of them continue to replace, including her. I shouldn't say that because we are in troubles legally. So I'm not going to say it in public, but nonetheless, you know she spoke about Mind the Gap report. Let me stop there. She's a chief nurse officer in Humber River, who is doing fantastic work. With that, we need to stop in tertiary quaternary care this replacement of RNs and move to an all RN staff in tertiary quaternary care. And I know that my colleagues will be celebrating because the ones who will celebrate is patients. It's patients that will celebrate. So, for your daughter Maggie, you may remember that when she started nursing school, my colleagues and I gave the nursing student pin. Yes. Now, I was not aware, and I must acknowledge now, very embarrassed, that she came to one of our assemblies, but she was so humble that I actually learned after the fact.
Oh, she didn't tell you?
No. And she heard all the plotting, which is good. So you tell her, please, that now she has an RN pin. I also know she sent me an email that I never answered, so I acknowledge that from my heart. Because, of course, I didn't, my dear people look at the emails when you get that amount, and you know that.
Okay.
Tell her to send and say, I am Maggie in the subject. I promise I will look, because we will, and I mean we, right? Not just me. We will take it under our wing to continue to plot and to make the system better and better and better and better, right? So in case that she is like some of my members, but not many because all of them are with this, they're well, right? But if she says once in a while when we see her or they see her, I forgot it in the fridge, I forgot it in the car, here is two. So now we can entertain, oh, look at them.
I know, there are many.
Okay.
Many. Okay. Well, thank you, Doris, and I will pass these on to Maggie, and you'll be happy to know, Doris, that Maggie pushes me just about as much as you do on everything. So, third children. Okay. Happy to take your questions.
My name's Laurel. I'm a federal corrections nurse, and we also are seeing RN replacement happening there, and I know that there's not anything that you can do about that, but just want everybody to be aware that it is happening, and it's happening very rapidly. It's quite staggering. Just a couple things that I wanted to mention, and I will keep this brief. I almost cried last night when I heard the announcement about the Medicare for children, because I worked as an emergency nurse for many, many years, and I would see patients leaving with their families knowing that they could not buy that inhaler for their child, and knowing that they couldn't fill that prescription, and it would break our hearts. And one thing I would like to encourage as part of this, though, is that with those inhalers, they need aero chambers. That is best practice.
So is that, okay, here we go. The education of Kathleen continues.
It's a better way to deliver the medication so that it gets in their lungs and not in the back of their mouth.
And it doesn't automatically come with the inhaler, okay.
Our hospital would let us use the aero chamber to deliver the medication, but we were not supposed to send it home with the families. Now,
Okay, I'll
We
take that
do.
back to the yeah. I'll take that back to the minister. Thank you for raising it.
yeah, especially for children, but everybody really should be using an aero chamber every time they deliver asthmatic medication. The other things that I would just like to encourage you to continue to look at or to work toward, obviously full coverage for pharmacare for everyone.
Can I just address that for a second? We looked at what we could do, and we're doing what we can, and we're doing it in the way that we think is the most complete. In that conversation at the table with my colleague premiers, I will certainly be working with them as we all make the case to the federal government that we need a national pharmacare plan, because that really is what we need.
I understand completely that not everything can be done in one fell swoop and one budget and one province. So, I just encourage you to please keep sending that message forward. But the other thing that, two other things that came to mind when you were having this discussion was physiotherapy and dental care.
Yep.
Should also be standard.
Thanks very much.
Madam Premier, my name's Kathy Crow. I'm a street nurse in Toronto.
Kathy.
Hi.
It's an honor to meet you.
Thank you.
You are a hero.
Well, thank you.
You are.
I want to thank my nursing colleagues, including Doris and many others. I know they have advocated for affordable housing. I did cry last night because yesterday I saw the results of new research that shows that a homeless person is dying every 5 days in Toronto. I want to see an Ontario where new affordable housing builds are happening across the province for co-op housing, for seniors housing, supportive housing. And I just have to beg you to tell us, why was there no new money for affordable housing builds in yesterday's budget?
Well, Kathy, thank you. And I know I know the mayor and I are going to have a conversation about this.
I don't often agree with him, but I do today.
Well, but I do have to say that there are a number of things that we're doing. You know that there's money that we have put in place for the homelessness strategy that will actually, it won't always build new houses, new units, but it will provide rent supplements, which will allow people to get off the street and get into much more quickly than we could actually build housing. And we've put that money in place. There's $500 million that's going into building affordable housing, including $130 million for Toronto. There's another $130 million that's going into retrofitting social housing, so that should allow them to open some of the units that they otherwise would have to close. So we are working with the city. I know that the mayor would like to see more. The reality is that there's need across the province, not just because I can go to the north, and there are people coming in from the far north who end up in Thunder Bay or Dryden or Kenora, and they need supports as well. So we're working with all of those municipal leaders. Thanks, Kathy.
Good morning. Thank you very much for taking my comment and my question. My name is Sheena Howard. I'm an RN, but I'm also a mother. I'm a mother of a boy who will be 11 years old in January when your new policy takes place. My son has ADHD, generalized anxiety disorder, and dyslexia. We spend $300 a month on his medication. By the time he's 25, the savings will be $50,000. And that represents his post-secondary education.
It's fantastic.
I'm also the president of RNAO's Primary Care Nurses of Ontario Interest Group, and one of my colleagues, Brandy, has a very important question to you about equitable compensation for primary care RNs.
Okay.
This is my question.
Okay.
It's okay. She framed it as her question, so we'll.
I'll ask for your patience. I'm extremely nervous
Can you
to
just
be
hold
up
on
here
one
today.
second? Doris is speaking to me. Sorry, go
I
ahead.
said, first I'll ask for your patience. I'm extremely nervous to be up here today. I'm from Northern Ontario, and I hear in the North a lot, nobody cares about us and nobody listens to us. I also lived in Southern Ontario for 10 years, and I promised all of my colleagues from Kenora that I would come up here today and speak for them so that they could hear our voices.
Thank you for doing that. And I spoke to your mayor yesterday. I spoke to Mayor Canfield. I actually do care about the North very, very deeply.
Yeah. So yesterday I heard a lot about ER wait times, and this is an especially huge problem in Northern Ontario where we have physician shortages. In the North, we have primary care nurses, especially primary care RNs, who actually keep people out of our emergency departments and decrease those wait times. So my question for you, as a family health team RN, who, by the way, makes less than all the other nurses in this province, my colleague Colleen, who is an RN with 30 years experience and works independently, makes $32 an hour. So why have we not received pay increases for the past 10 years, and every other public service employee has gotten 2 or more pay increases? And I just want to clarify to everybody that by pay increases, we don't mean raises, we mean pay equity with the rest of the RNs in Ontario.
Yeah. So that's a great question. That's a great question. There actually is money in the budget to address this, and Doris, that's what Doris was saying to me, was the amount, which is $145 million. We recognize that that gap needs to be closed, and so we are starting down that road to make sure it happens, okay?
All right, thank you.
Okay.
Hello, I'm Anne-Marie Moeller, and I'm President-elect of Parish Nursing Interest Group. And Kathleen, thank you. I had breakfast at Queen's Park. You were gracious to listen to myself and a number of other nurses about issues related to scope of practice, et cetera.
Pleasure.
But today I want to really applaud you on your pharmacare announcement, but really want to have you invest in good, evidence-based, quality palliative care. Woo! As a parish nurse, along with my colleagues, I deal with a lot of seniors. I deal with people who are vulnerable with various disabilities, and they're really scared. They don't feel they have a choice. So I think an infusion of funding into good palliative care, including hospice care, so people can actually stay at home at the end of their life with those who love them and have that choice. Thank you.
Thank you very much. Thank you.
Excuse me, I am going to interject just for one moment, Premier. Just those standing currently we'll be able to take questions, and then we'll have to end those, okay? So just those standing. Thank you, Premier.
Go
Hi,
ahead.
my name is Esther. Thank you, Premier Wynne, for being here today. I did my nursing training in Sault Ste. Marie at a newly built hospital paid for by the Liberal government and very well promoted by David Orazietti. And I am currently working at the Niagara Falls Hospital, where I'm going to be working in a newly built hospital in less than 10 years because of the funding you announced yesterday.
Right.
However, in Northern Ontario and in Southwestern Ontario at my job, I've seen the same things. Patients must travel long distances, either because of the remoteness or because services have been centralized. Will your government be doing anything to help these patients access services? I'm thinking mental health, I'm thinking rehab. Will you help them get to those services in their communities rather than forcing them to drive or catch a ride to the central hospital, which is 10 minutes or more outside of their communities?
So I appreciate this question, and I have been saying for some time that no matter the policy area in Ontario, at some point we bump up against geography. It's just a reality. And so we actually are increasing the Northern Travel Grant in this budget because because there will always be some things that patients are going to have to travel for. It's just impossible to provide everything, and I think you know that. But having said that, we need to find better ways to connect services. And you mentioned mental health, and I think that's a particularly important one. How do we make sure that services are available in, you know, Sault Ste. Marie is not as remote as many communities, and so when I go to communities, some of them on the James Bay coast or in northwestern Ontario, there are going to have to be solutions. Some of them will be technological solutions. Some of them will be human resource solutions. You know, I'm going to link two things now. I'm going to link the economic development of First Nations communities and healthcare. We can't talk about mining development or the Ring of Fire without recognizing that people in communities like Webequie need to have supports. They need mental health and addiction supports, and so we're actually putting money into those services in those communities as, of course, those are social supports and health supports, but they're also economic supports. So we recognize that, and so through the Ministry of Health, but also through the Ministry of Indigenous Relations and through the Ministry of Housing, there are a number of ways in which we're trying to put the supports in place, and we'll continue to work to find solutions.
Thank you.
Okay.
Hello, Kathleen.
Hi.
Thank you again. So my name is Mahogany Hines. I'm from Region 3, Niagara. I am Policy and Political Action Executive, as well as on the Palliative Care Nurses Interest Group. So you will also be hearing another palliative care stipend, I guess. So as you spoke about fairness, equality, compassion, end-of-life care requires the same respect and action that we are putting forward for all of those at the beginning of life. Throughout that trajectory, we need to support people that need better palliative care. We have to give them equity. And the problem is as much as we put money into hospitals, which is fantastic, in those home care sectors, we have to support. We have to make sure that we're not having RN replacement happen, especially in hospice and ICU and all of those critical care areas.
So as we work together, it is absolutely inevitable that this will be part of the conversation when we talk about the RN replacement issue. And so I commit to you that we'll work with you on it. You know, we have put a lot of money into hospice and palliative care over the last number of years. We're putting more money into community care in this budget, and we'll continue to work to find that continuum of care, because that's what it is. It is not just one thing that we need to invest in. It's making sure that people get on that journey the right care at the right time. And I know that's what you're advocating for.
So in Niagara region, we have 37 beds, and then we have long-term care. We just need to make sure that we support that. So I just want to make sure that it's across. So there's no, we're not dealing with the postal code lottery.
Yeah, thanks, Mahogany. Thank you.
Veronique Boscard. I'm an outgoing board member. I'm also a very proud long-term care nurse for the last 24 and a half years. And I want to applaud your work, and I want to thank you for your courage and your values as a leader, as a woman, and as a mother of a nurse, because it makes a difference for healthcare in Ontario.
Oh, thank you. Sounds like you come from a part of the world where, are you from Holland?
Nederlands.
Nederlands, jawel.
Dank u wel.
Alsjeblieft.
But I'm going to ask you to also pay attention to long-term care. As a nurse, between 60 and 75% of my shifts that I do in long-term care, I will do a double shift, which means I work 24 hours straight. So I know that as a long-term care nurse, when I pack my lunchbox and I go in for a shift, I know I will not come home for the next 24 hours. It's not great care. I do the best I can. The funding system for long-term care makes me do great work, but the better I do my job, the less pressure ulcers there are, the less falls occur, the less funding my home receives, which means we cannot keep nurses in long-term care. So I would ask you to please look at it and see if there's something we can do about the funding system, because the better the nurses in long-term care, the less nursing time and money we have.
It's a great point. Thank you. Thank you.
Good morning, Premier Wynne. My name's Mandy, and I'm here representing the Brant chapter, where I'm the Policy and Political Action Executive Network Officer. I work in a community hospital that I've worked in for 30 years, so I've been able to see changes to our hospital system. I'd like to commend your government on its accomplishments and its commitment in addressing the social determinants of health and supporting child health. I'd also like to, while I do acknowledge the need for fiscal accountability, I would strongly urge your government to look at our hospital systems. Our hospitals have been hobbled by the changes to the funding model, and our hospitals are really the framework of our healthcare system within the province. As hospitals try to balance their budgets, they're dealing with sicker patients who are much older, and in the absence of adequate funding, they're forced to alter their models of care, and this means RN replacements. RNs are being replaced with more cost-effective RPNs whose depth and breadth of knowledge may not be sufficient to address the complex needs of Ontarians, and this also results in increased patient ratios. Hospitals have requested a 5% increase to maintain the status quo. With a 3% increase, we can expect further RN replacement and a further erosion of our hospital system. I implore your government to do a deeper dive and to create adequate funding for hospitals to meet the needs of Ontarians.
Thank you.
Thank you.
Thank you.
Good afternoon, Madam Premier. I'm Paul Emanuel, Region 6, Toronto West. You happen to be standing in Toronto West right now. Queen's Park is located in our region, but I know you represent all of Ontario. So with that hat on, I am a clinical services manager for an acute care community hospital, a little west of here called Osler. And we have been, as you know, a little bit busy, along with every other hospital in the province, with something called gridlock. And gridlock is fascinating by having unfunded beds, perhaps in hallways. And I know, Premier, this is not exactly the vision you would have for residents of Ontario. I have concerns about that. And I'm also a manager who totally embraces the fact that there's synergy with RNs and RPNs in a community hospital. But I would like to know how we can get away from having unfunded beds, how we can get away from people not being able to get full-time jobs. And health human resources is something we've talked about for 20 years. Can we please make action on it? Thank you very much.
So I appreciate the comment, and as I said, we are going to work with you on the RN replacement issue, and I say that to the former speaker as well. We know that hospitals have been working under constraints. I said that in my remarks. I understand that there's a need for an infusion of money, and that's exactly what this budget provides. And we will work with hospitals. I think there was a sense of optimism yesterday. I think the sector was quite pleased. We'll see how that rolls out and continue to work with you on the specifics. So thank you for raising those issues. Appreciate it. And I guess the last thing I would just say on that, the issues around the continuum of care are also relevant to the gridlock issue. Where do people go? What is the appropriate place for them to be? And do we have the right levels of care in the community? That's why it's important that we put more support into the community as well, so that those people can be moved out of the beds. That's not the unfunded piece, that's the gridlock piece, and so they can be out in the community. Yes.
Hello, my name is Margarita Salvatore, part of Region 6. Premier Wynne, thank you so much for all that you've done in regards to healthcare so far, and especially the pharmacare and what have you. But I'm wondering about the sustainability of these types of endeavors long term, because some of the medications are quite costly, and how are we going to be sustaining it within your government, and not only within your government, but in other governments throughout, say, the PC party, the NDP, and what have you, because this is the most important thing. Yes, it's important to start these projects, but it's the sustainability that is the most important part. So
well, I have the answer on how to keep it going under a Liberal government. I can't, and I have an answer for next June, but I know that's not what you're asking me. I really believe that this is this is an issue that is understood nationally among people who believe that government has a role to play and believe that universal health care is fundamental to who we are. I mean, there are voices already in the province who are saying it shouldn't be universal, there should be a means test, there should be a co-payment, and we don't believe that, so we will continue to put in place what we believe is an important universal program. In terms of the sustainability, so that's the political side. On my watch and on our government's watch, we will continue to implement this plan and grow it as we can. In terms of the sustainability, that's why I think that there needs to be a national plan. I think that we can work to bring the cost of drugs down. I think that the buying and leveraging power of the province is one thing, but the country makes that even more viable, and so we'll continue to push for that level of support across the country.
Thank you so much.
Okay.
I'm Erica, and from South Simcoe Chapter, Region 5. I'm also one of the 72 social determinants of health, public health nurses in our 36 health units.
Thank you for your work.
Yes, and a big thank you first to RNAO for having the courage to advocate for basic income guarantee, and to any nurse in this audience who also had the courage to advocate for basic income guarantee. And Premier Wynne, an enormous thank you for having the courage to take a stand and support a pilot here with 3 communities and to be announced soon an Indigenous community to be a basic income pilot. So what I'm raising, so thank you. So following the announcements and reading all the comments and the Twitter feeds, it's very discouraging to see the thousands of comments that are not in support of it, but are demeaning, stigmatizing, and very sad, which indicates more of a huge lack of understanding of why basic income guarantee can lift people out of poverty and improve overall health status, because our people of low income are the ones with the worst health outcomes and struggle every day. So my ask is, can you, we would like to look at a more rigorous PR campaign, and also to really speak to the cost savings of supporting people of low income. The announcement talked about how much it would cost, but it didn't talk about the cost savings.
Right. And that's the point of doing it is the human saving, the impact on the human beings, but along with that, the savings in their lives and in their society. So yes, there's more education that we have to do. We get that. And as the project rolls out, we will be doing more of that to help explain. Some of those people on the Twitter feed, you just have to not listen to, trust me. But the ones who are questioning it legitimately and not for political reasons, because let's face it, I mean, there will be people who will just, because we're bringing it in, because we've suggested it, will say it's a bad thing. So, so those are not people who we're going to persuade. But people who have legitimate questions about how it will work, we are going to need to do more education. But the real proof will be in the pudding. Once we start to see how the program changes people's lives, and that's the evidence that we want to gather. And so we're not going to be deterred in implementing it, and then I hope we will have a really strong body of evidence that shows the benefit.
Thank you. We hope that this isn't going to be the demise of the party at the next election, but will be the motivator to be reelected and continue this project, because we know that you're behind this, and the demise of the Mincombe project was by another party, and the other party is not in full support of the basic income pilot, and we could see it come to an end. So for all of us in this room, we have a lot of work to educate, not just each other, but our other people in the other parties as well. Thank you.
Well, thank you for your support.
Good morning, Premier Wynne. Shirley Kennedy, the President of the Ontario Correctional Nurses Interest Group.
Nice to meet you, Shirley.
I am thrilled.
Thank you for your work.
Thank you. I am thrilled to hear you acknowledge in your speech that there's a need for a transformation of healthcare in correctional facilities. And I see that there is some money in the budget to address health issues for inmates. I'm wondering if you can give us a hopeful glimpse of what that might look like.
In terms of the transfer?
Well, is there a transfer?
Well, what we're... The issue for me, and I have been approached by some healthcare workers in corrections, the issue is where they should be located, whether in corrections or in the Ministry of Health, and that's the transition. I don't even know if that's public. I'm probably speaking out of turn, but that is the issue that we're confronting, and I believe that corrections and the healthcare workers in corrections should be part of the healthcare network and should understand that they're supported by that. So you will know we're working with Howard Sapers. You will know that there's a lot of work to be done before that can happen, but that is the issue that has been raised with me. That's the thing I'm concerned about, and I want healthcare workers in corrections to have the same support that healthcare workers outside of corrections have, and I want inmates and I want corrections institutions to be places of restoration, not places of retribution. I think that it is one of the most short-sighted things that as a society we have done, which is to rely on punishment as somehow a way to prepare someone to go back into society. And I'm not excusing heinous crime. What I'm saying is that most of the people who are incarcerated go back into society. And so, they need to have the benefit of a rehabilitative process, a restorative process that allows them to re-enter society. And part of that is having healthcare workers, particularly people who understand and can work with mental health situations, that we need those healthcare workers to be supported so that they can do their best work, so that those people can be as whole as they can be once they come back into society. It's a long road to that. It's a really long road, and it's not going to be easy what we're looking at and what you've been advocating for, but we're sure going to make a start on it.
Thank you.
Good morning, Premier Wynne. My name is Opal Smith. I work with Shibogma First Nations Council. I am the Director of Nursing there.
Where are you?
Sioux Lookout, Ontario.
Sioux Lookout, okay, yeah. I was there in the summer, and there's a lot of good collaborative work being done in Sioux Lookout. Congratulations.
Thank you. I represent 3 remote communities this morning. I supervise the nurses there. I recently had nursing shortage, so I had to go up to work. And I worked for 19 hours straight. I had a patient, a young girl, who came in and she had mental health illnesses. She tried to commit suicide. And when I called Orange to get her transferred out of the community, because it is a flying community only, I was told they only had 2 airplanes or 2 helicopters. Well, first of all, we have over 30 communities in the north. Now, to only have 2 helicopters to service others, that's an atrocity to start with. I am an emergency trained nurse, and I worked in the south for long periods of time in emergencies, and I see people come in and they are treated. I worked for 19 hours with this mental health patient, and I had to sit there because the nurses, the clinic was open in the morning again. So now somebody has to work in the night. It's not a hospital, so I lost my sleep. And every time I called, I was told, well, she's not a priority. We have people who are sicker than herself. So when is mental health going to be a priority? That's my question.
So I appreciate it. I think you probably know better than most people that mental health is, there's more awareness about mental health today than there was even 5 years ago, certainly more than 10 years ago. And I will be honest with you, we are catching up. We're putting $140 million more into mental health in this budget. We know that there's more that we have to do. And, the double-edged sword of awareness is that we have we do have more awareness, that's a good thing, but the flip side of that is that the system has not caught up and the resources have not caught up. So we will continue to implement our mental health strategy. On this particular issue, again, this is a remote and northern resource issue as well as it is a mental health resource issue. And so I've made a note about the situation that you raised, and I just can't tell you the formula around the number of helicopters. I just don't know, but I'll certainly take it back to the ministry.
Great, thank you
very much.
Thank you.
Thank you, everybody. Thank you so much. Merci.